Good evening. This is Dr. John Bennett from Miami, Larkin Hospital TV. Tonight we have the pleasure of having Austin Walters. He's a healthcare innovator that spent a lot of time in the Far East and India. And I don't know the exact details of what Austin's been up to lately, because I did have a conversation with him about a year ago, and he was in Thailand. So we don't have Austin's video, but we'll make do with the conversations because really we're after what he thinks. So anyways, good evening, Austin.
Good evening. Thanks for having me.
Sure. Now, Austin, why don't you just begin by telling a little bit about your background, the way you went to school, and you know what I really like to ask guests is how they got into computers, because obviously you're internet savvy. Could you do that, please?
Sure. So I went to Brigham Young University in Utah undergraduate, studied international relations and Russian. And then I moved to Boston in 2009, and I did a couple years of consulting with a firm called InnoSight. And they specialize in disruptive innovation. They were co-founded by Clayton Christensen, who is the author of The Innovator's Prescription, which is a healthcare reform book that a lot of the hospitalists and administrators would be familiar with. And then I went to Harvard Business School, and then I took 2 years off to research medical devices, largely from India, and I publish about those on a research blog at globalhealth.care. And I'm now back in Boston to finish Harvard Business School with a much closer focus on medical device innovation, and in a lot of cases, devices that have originated, at least in their design, from emerging markets around the world.
Okay, I've got your website on the screen now instead of your face, so people can see that. Now, you've learned a lot you spent most of your time in India when you were overseas in the last couple years?
Yes.
Well, which city in India?
Almost entirely in Bangalore.
Okay, Bangalore, that's the computer center, correct?
It is, yeah. It's kind of the Silicon Valley of India.
Right, right. Yeah, I've talked to doctors over there. India is pretty internet savvy.
Yes, they've got nearly as high of a smartphone saturation rate as the West, and it may actually be higher by this point. There's you may be familiar with the term leapfrogging.
Yeah.
So there's definitely a leapfrog effect in India with internet-enabled devices.
Yeah. So you've kind of like one thing that struck me about your website was the emerging market healthcare innovations that you kind of listed. Are you familiar with them at all? Most of them, or?
Oh, yes.
That you listed? Okay. If you don't mind, could we go through some of them? Because that's what really attracted me to talking to you, because you kind of have boots on the ground knowledge of these things happening.
Yes.
And most of, I think most people don't realize the things that are being developed in a foreign country like India. So I have on the screen your innovation database in front of us. It's on the screen right now.
Yep.
Novel One Bag. Do you know much about that? What that is?
Yeah. So the Novel One Bag is it's a very low cost option for peritoneal dialysis.
Okay, I heard about that. Yeah.
And really, these dialysis centers and machines that we utilize in the West are just too high cost and too centralized of a model to fit India, where transportation logistics are a big barrier and cost is an even bigger barrier. So with this solution, it's a kind of it's a self-administered therapy using this device, and it's peritoneal dialysis. And it's much lower cost way to do that.
I did hear about that. I think it was based in Bangalore. They were writing about some person didn't have to come down from the mountains. And people, I guess, like you said, they're in the boondocks and they really can't afford to keep running to the cities for every dialysis treatment. Is that in widespread use or just in pockets around Bangalore? Do you know?
No. That I think that they're by this, and Micra Industries is not the only company in India providing these lower cost bags, but this is a good example of a kind of, cost driven engineering that I'm interested in with these devices. They kind of took a ground up approach to redesign the thing, and they came up with a very, very much lower cost, more rugged, reliable solution.
Mm-hmm.
That is a much better fit for peritoneal dialysis than what we have in our country in many ways. There's just not a lot of innovation being done on PD in the U.S. Because it's not where our focus is.
Okay, the slit imager, $200 Fundus camera.
Yeah, so this is another good example. If you look at some of the high-end providers of Fundus cameras for ophthalmology, you've got Zeiss and some of these German lens makers. There are many thousands of dollars to buy one, and slits as well. This is a device that actually attaches to a specific camera model, and it can actually it's non-dilation, so it doesn't require pupil dilation, and you can get pretty much all of the photographs that you need 90% of the time. Mm-hmm. So there are instances where the highest end devices provide benefit. It's just that those really aren't that common. And so to force everyone to buy the expensive models just in case, again, mostly works in the US, not so much in India. So there's even better examples of this. The disruption here has gone further. There's a scientist at Stanford, Asian American scientist who has created a $10 attachment to a smartphone. Mm-hmm. Through which you can take Fundus images that are good enough.
Is this one compatible with a smartphone? Still a slit imager?
No, the slit imager is not. I would say it's actually behind the curve on this one.
Okay. Now, one thing that looks fascinating is a swastika slate, a diagnostic device for 30+ conditions.
Yeah, this one is quite interesting. It's a professor out of Arizona, Indian American. I think came to the U.S. to do his PhD in electrical engineering. Was teaching out of Arizona State. A high-ranking political official in India convinced him to move back to India and develop this diagnostic device. It's largely funded by the government. And what it is it's just a tablet-sized device that has a lot of plug-in capabilities. So you can plug in a lot of extensions and peripheral devices into it, and it will process their data, standardize them, and then it allows for the storage and transmission of that data. Mm-hmm. So when you add all that up, you've got the point-of-care diagnostic ability. For 30+ conditions. So there's some biochemistry there. There's also, oximeters that are non-invasive. Different things like this. It's really taking advantage and trying to provide a platform, if you will, a kind of platform device for a lot of these already miniaturized sensors that measure different things about a body. It's just trying to integrate all of those into a single device.
Austin, you've got to get together with, Shiv Gaglani, the MD, the smartphone physical.
Yeah. Yes.
You got to get together with him. Have you met him yet?
I haven't met him, no, but I've read about him in Topol. I think he and Topol collaborated a bit on an illustration for a medical smartphone, if I'm right.
Yeah, well, he started very early with a smartphone physical, and as you know, it's built more and more things onto it, more and more devices, add-ons, accessories, and transmissions of various sensor data.
Yeah.
He's really at the top end of development of things like this. You guys got to get together. You're both medical device guys.
Yeah. Well, I'm writing his name down now, so.
Well, I'm sure you'll run into them eventually. Let's see what else here. Can't go through all of them. I'd like to, but I don't want to take all your time up. And you just wrote about the Remotion Knee in your blog.
Yeah, I did. That's a pretty amazing example. You know, the if you look at the incumbent market, you know, a prosthetic knee, you got to replace it every 4 to 5 years. You're looking at $20,000 to $50,000, depending on a person's insurance. Half of that may be out of pocket. A lot of people, even in the U.S., for whom that's quite a financial blow. So, you know, and in India, it's unimaginable. So, Jaipur Foot's the organization that since the 70s has been creating $5 prosthetic feet. So, with the help of DREV, a prominent medical design firm in San Francisco, they've now created this Remotion Knee, which is kind of a second generation to a prior model of prosthetic knee they developed. It's much better, and it seems to be, you know, perform very, very well. And it's, you know, $80 at retail.
There's an organization called Enable. I don't know if you've heard of them.
Yes, yeah.
Okay, they do the same thing for hands, etc.
Yeah, I think they utilize 3D printing, don't they?
Yes, 3D printing to make low-cost prosthetic hands and fingers.
Yeah, pretty exciting trend.
Great organization. And then one more, which I found interesting. There's a lot of interesting. Touch hemoglobin transcutaneous anemia meter. Do you know BioSense? Do you know anything about that one?
So I'll say the ones in green on the top of the list there are ones that I've written about.
Oh, okay, okay.
And the ones below I'm still researching. I'm about to publish the next one on the list, the Medtronic's pill-sized pacemaker. That's actually called the Micra TPS, a transcatheter pacing system, and it's the size of a pill embedded internally for right atrial fibrillation. Amazing device, but unfortunately, I think they're probably going to charge more for it than the old pacemakers. But it seems to have a lot of disruptive potential to me.
Well, you know, I ran into well, speaking of anemia, there's a chiropractor in Mumbai, because I do a lot of interacting with doctors over there. Well, he's a chiropractor actually, which you know, I don't know, some people consider him doctors or not. But anyways, he developed an app that's just in the Apple Store for detecting anemia non-invasively, just putting your finger on a sensor. And I don't know how reliable it is. I can't really vouch for its reliability and quality, but he's working on it. And if it could be accurate in a country like India, that would be tremendously helpful to non-invasively detect anemia with a smartphone and an app. So yeah, there are a lot of exciting things happening out there. It's really hard to keep track of it. So, you know, you're kind of the interface between the third world and the developed world as far as what devices can be brought to the developed world. Is that correct?
That's what I'm interested in, really, is how devices developed for these other market conditions, right? Where in a place like India, they've got a lot more cost pressure.
Right.
You know, very small percentage of the population is gainfully covered by insurance in any meaningful way, and so they, you know, a lot of it's out of pocket. So it's actually a real market, and you know, people are very price sensitive about things. So you see a lot of these products, and there's a lot of engineering talent in India. And by the way, 2 of the devices on the list, actually several, have been created through, you know, under the auspices of multinational corporations, but within their India offices. So Medtronic's pill-sized pacemaker came out of their work in India. And yes, trying to figure out a way to develop something less invasive, cheaper. General Electric's, they've got a miniaturized CAT and PET scanning machine that costs, I think, like 3/4 of a traditional model. And far more disruptively is their handheld ultrasound device, V-Scan.
Yeah.
They developed 7 years ago out of GE Healthcare India.
Right. So, well, that's where it came from.
That it came from India.
Wow.
So what's so fascinating is that that market and its constraints feed into the very engineering of new devices.
Right.
And so that market produces very disruptive devices. And I think that a lot of those can actually start to leap back up the pyramid into Western healthcare markets, just as you're seeing the Vscan device start to do.
Well, I think a parallel situation exists in stem cells and 3D because of the not the lack of regulatory oversight, but it's easier to test for to do stem cell research and stem cell experimentation in Korea, and in China it's much easier to experiment with 3D on 3D developments on humans because there's not so much regulation as the United States. Whereas there's so much super regulation of many things, and it takes many years for any of these devices to get to be used by patients.
Mm-hmm.
Right? It's the same thing that you're watching a lot of devices that maybe would have to go through FDA scrutiny. Is that true or no?
Yes, and a lot of these that have potential to reverse their way back to into the U.S. at least are Class 1 or Class 2 medical devices. You're not seeing a ton of innovation yet in the Class 3 medical devices from India, but I think there'll be more and more of that in the future. And so it's a less rigorous FDA approval process for Class 1 and Class 2 devices, but yeah, that is a big barrier. For a lot of entrepreneurs thinking of commercializing in the U.S. is just the added cost from the regulatory pressures and then the reimbursement system and other factors. So it's a difficult problem, but I think we're starting to see it in a number of ways.
Yeah. Well, my thing is basically doing hangouts with people around the world, but one of the things I find tremendously exciting is the potential to interact with scientists in both Korea and China, which of course they have the Google restriction, but you can Skype. With the things that they're doing, it's kind of see what's going to happen eventually here with both stem cell and 3D printing. And this platform allows us to do that. We don't have to read it about it in a magazine 6 months from now. We can see late-breaking development. So hopefully, Austin will be able to get the scientists on the screen and talk about it. But of course, there's a restriction, and I'm sure you know about, with researchers. But I think there's less restrictions over there. In the U.S., I don't know. Do you find, that's another question for you, I guess. Do you find talking to researchers is easier over there than here? Because there's the privacy concerns and the funding concerns of researchers in this country. Does that exist also in India? They have to kind of keep quiet about what they're doing?
In terms of intellectual property protection?
What devices they're working on, what they're doing, essentially.
Mm.
Where they're going with something. Do you find a lot of that? My boss told me not to talk about it. I can't talk about it because we're going for funding.
Yeah. I think that you see a lot of that in India, definitely, because there isn't the same kind of IP law, and and so it's a bit of a wild west when it comes to innovation and the sharing of ideas. It's kind of a leaky intellectual landscape, if you will, where it doesn't necessarily take long for a new technology that's introduced by one company to then get picked up by a lot of innovators that can reverse engineer it and start to build their own things, or scientists or researchers that leave a multinational corporation like Medtronic, GE, or Philips based in Mumbai, and then go and start their own company doing the same thing. And that happens in the West as well, but the flow of ideas, I think, is a bit more free in India, probably, just because there's not that basis of IP law. They're not to the same level of enforcement.
So your work now is kind of suspended. Now you're in school, or are you kind of doing it part-time?
Oh, still pushing it forward. School doesn't start until next month, so I'm still publishing articles, and I'll continue to do that in the coming years.
Okay, well, I'd love to get you on a hangout with Shiv. Shiv Gagnon.
Yeah, well, I would definitely welcome that opportunity.
Well, I'm going to approach him because one of the members of my team works with him. But he's like you; he's a super busy guy. But you never know. I'm sure when he sees your profile, he'd be interested in your work with. I mean, one thing I find fascinating is being in another country, working with devices and how they develop, and seeing like you'd like the peritoneal dialysis. That type of technology, I think he'll find fascinating too. So I won't keep you too long. Thank you very much, and hopefully we'll do more of these. And anyone you want to reach out to engage on the screen like Shiv, let me know, and I'll try to get him on the screen with you.
Wonderful. Well, I do appreciate the intro to Shiv, and I hope that happens, John. It's been great to talk with you.
Okay, I'll talk with you later, but anyone else you want to know about or get on the screen with, just let me know. Great.
Will.
Hold on. Thanks. Thank you very much. I'm just going to wrap it up.